Alfred Lee's synopsis of anesthesia. I'll just go for the point to show the screen visible.
Yes, sir.
Yes, sir.
Okay. So 65 years old male, known case of essential hypertension, 15 years on telmisartan, Silacar, posted for bilateral open inguinal hernia. How to manage? This is the question. So this is a case of chronic hypertensive patient posted for a minor surgery. Because hernia, unless it is complicated by irreducibility or a permanent large bowel extruding out, all superficial small hernias are considered as a minor surgical procedure. So here is a chronic hypertensive patient, 15 years of duration. So the problems can be divided into always, as I told you, you both for your future practice as well as for examination purpose, you always analyze the challenges that you face in a patient. So here you have a geriatric patient and all the problems of geriatric anesthesia are there, and he has a long-standing hypertension. So history required regarding hypertension, most of the things, mode of detection, whether the patient was asymptomatic or symptomatic at the time of detection itself. Because some patients will say, I develop a headache every day, and then I went to the doctor. He has first advised me to go and see an ophthalmologist, and the ophthalmologist said my vision is normal. Then he checked my BP and found the BP is high, and then he said maybe this is the reason for your headache, and started me on medication. Then I became all right. So patient may be a silent sufferer from hypertension, or they might have symptoms at the time of detection itself. So patients having symptoms at the time of detection are likely to develop end organ damage. So as the medical books, if you see, hypertension per se is not a problem. It is the end organ damage which is the problem in these things. So three important organs that will be affected by long-standing uncontrolled hypertension are, what are the three important systems that can easily get affected?
Eyes,
Starting from the head, is the cerebrovascular or the
Brain,
central
eyes,
system.
and kidneys, sir.
Then second is the heart. Third is the kidney. Okay, these are three important organ systems which can be affected: cerebrovascular, coronary or cardiac, and renal. Of course, the visual disturbance like retinopathy and all, they are all minor things. That they are not going to kill the patient. But these three systems which are likely to get affected by uncontrolled hypertension, they are the ones which have to be taken care of. And is the first thing always when you make a diagnosis of hypertension, rule out secondary hypertension, like causes of secondary hypertension, especially nowadays young individuals in the IT profession, even at the age of 30, 35, they all come with the high BP of 160, 100, 150, 100. It has become very common. So in that age group, you first make sure that it is only essential hypertension by investigating them thoroughly to rule out secondary hypertension. What are the common causes of secondary hypertension?
So chronic kidney disease.
renal artery stenosis, sir.
Bilateral congenital renal artery stenosis, very good. Then
Endocrine causes like
endocrine,
Pheochromocytoma.
chromocytoma, Cushing's,
hyperthyroid, Cushing's,
thyroid, all these things have to be ruled out. Okay, so
Yes.
renal and endocrine causes have to be ruled out for secondary hypertension. And then initial treatment advice: is the patient on same medication, or it was altered because it was not coming under control, or was it changed because of the newer recommendation? So this patient, 15 years, he might have been first started on atenolol or propranolol as a recommendation at that time, then changed to telmisartan and calcium channel blockers as the time went by. So you must know whether the medications have been the same or there have been changes that have been taking place. for two reasons. One is he may not have responded to the initial medication, which required treatment to be modified, or the physician treating may be very well versed academically, and he might have recommended that newer recommendations by the Joint National Commission instead of sticking on to the old medications. Okay, so the frequency of monitoring and mode of self, whether it is by self or by physician, any target organ dysfunction, especially CVS, CNS, eye, renal, these four things, any episodes of accelerated or malignant hypertension, investigations to check the functions of target organs and the effort tolerance, whether the cardiac system has been affected by any long-term hypertension, and check the adequacy of control of BP and need for alterations of drug usage. Then preoperative instructions for elective surgery about whether to stop or continue with the antihypertensive medication. Intraoperative, you have to choose between RA versus GA and advantages and disadvantages of each. So my choice also would be combined spinal epidural as the first choice of central neuroaxial technique. And only if the patient refuses, and here also Vidya said that if he is on anticoagulant, I will avoid. All that need not be told, okay?
Yes.
Unless the examiner asks what is the other contraindication for not choosing central neuroaxial, then you can say, because in this history, patient is not on any antiplatelet agents or anything. So unnecessarily, we need not go into that, commit ourselves saying that if the patient is on anticoagulant, there are two things that can happen. One, the examiner may think that you are trying to show off your knowledge, or second, he may go into antiplatelets and try to pull you down in that particular discussion and get you into trouble. So it is always better to limit your answer to the scenario so that you don't get into unnecessary trouble by unwanted discussion in the examination. And then coming to GA, you can choose between the advantage of supraglottic airway devices should be definitely thought of in this case, because it's only a hernia surgery, which is a superficial surgery. And post-op management should be good control of blood pressure, again to avoid the complications, and good pain relief, which is the main reason for the BP to go up. Okay, so these are all the things that you have to remember in this particular case. Okay, we'll stop that. Any doubts or any questions on that?